Health Spotlight, presented by Community Health Network.
In tonight's Health Spotlight, understanding the impact childhood viruses have on mental health later in life.
Joining us now to explain is Wish TV's medical reporter, Dr. Mary Gillis. Mary.
Well, major depressive disorder is characterized by a persistent feeling of sadness, loss of hope and interest in activities you once enjoyed, causing a significant decline in quality of life. Possible causes include a combination of environmental, genetic, and lifestyle factors. And now scientists say the number of viral infections in early childhood may also play a role. In a longitudinal study using a large database, researchers in the UK examined the link between infections like chickenpox, measles, meningitis, whooping cough, and influenza by following 12,000 children ages 1.5 to 7.5 years old. Beginning at age 10 and every 1 to 3 years after, all participants were screened for depression and/or psychotic episodes. Results showed the higher the number of viral infections they had as a child, the more likely they were to suffer from depression as adolescents and teenagers. They were also 1.6 times more likely to experience a psychotic episode. In the paper, authors write, childhood infections are inevitable, but the adverse outcomes of such physical health problems may go beyond physical health later in life. Here we present evidence that childhood infections, particularly a very high infection burden, can negatively impact mental health well into adolescence. Future work is needed to replicate the observed associations between common childhood infections and mental health outcomes during adolescence, and to elucidate potential mechanisms for these associations. The study was published in Psychological Medicine. Reporting from the newsroom, I'm Wish TV's medical reporter, Dr. Mary Gillis.